Hi, my name's Wendy Johnson, and today we're going to talk about instructional guidelines for dressing change of central venous catheter sites. These are our learning objectives. We want to make sure we understand the use of central venous catheters, understand proper central line dressing change procedures while maintaining safety and infection control precautions. We want to demonstrate appropriate documentation of assessment data and patient findings. And also, by the end of this module, we want to be able to explain the risk associated with central venous catheters and identify nursing actions that can help reduce the risk of central line associated bloodstream infections. Central venous catheters, or central lines, are used in acute, ambulatory, and subacute settings in the hospital, home, and long-term care settings. They provide access for IV fluids, medications, blood products, and TPN solutions. And they provide access for hemodynamic monitoring and blood sampling. They are usually inserted into the subclavian or internal jugular vein and pass to the superior vena cava, just above the right atrium, and they do require radiographic confirmation of position. According to the Centers for Disease Control and Prevention, an estimated 41,000 central line bloodstream infections occur in U.S. hospitals each year. We do have strict guidelines that have been implemented for the care and maintenance of central venous catheters. However, they do continue to happen. Unfortunately, in spite of our best efforts, the financial burden on the healthcare system is estimated at $36,441 per episode. Prior to doing a central line dressing change, there is equipment that you will want to gather. This is going to vary from facility to facility, because facilities, most of them will order a central line dressing change kit, and some of these kits will have supplies in them that others do not have. So you will want to grab a sterile dressing change kit, the chlorhexidine preparation with alcohol, transparent dressing, also called Tegaderm, or if you're doing a gauze dressing, gauze, sterile gloves, additional gloves, mask for a patient and the person completing the dressing change. You will also want to check with the hospital and what their protocols are, or the facility you're at, because this does vary. Skin prep, as well as a bio patch. Dressing change frequency. Transparent dressing changes are completed every 7 days. Gauze dressings, however, are done every 48 hours. You will change a dressing more frequently. If it becomes soiled or loosened, it will need to be changed. You want to gather all your supplies needed, identify the patient and explain the procedure to the patient prior, perform hand hygiene, wear a mask during procedure, don gloves and remove the old dressing. You'll assess the site for signs of infection and make sure that you have the appropriate documentation for that. And then you will open your sterile gloves and set up your sterile field. Sterile dressing changes are can be, a large task, especially if you're working in a pediatric setting. So you may want to have a partner to work with you. So you'll don your sterile gloves, you'll clean the skin with the chlorhexidine preparation, and then you will begin cleaning at the insertion site in a circular motion, moving outward. You don't want to contaminate the field that you've already cleaned. You will allow this to dry completely, and then you'll apply a skin prep to the outer area of where the dressing will be applied. You will then apply the bio patch, apply a transparent dressing. You'll label the dressing with the date, time, and initials of the nurse that's completed it, so that will be you, and you'll complete the appropriate documentation.
The frequency for doing a central line dressing change is based on hospital policy. First, I would begin by gathering my supplies. I would need a central line dressing change kit or tray, non-sterile gloves, a mask. I will enter my patient's room, wash my hands, introduce myself to the patient. While looking at the identification bracelet, I want to ask my patient to state his name and date of birth. Then I will explain the procedure to the patient. I will pull the curtain for privacy. I'm going to lower the side rail and raise the bed to a workable, comfortable working position. I'm going to open my kit. I want to open this away from me. I will remove the mask and place on my patient. If the patient can tolerate wearing the mask, that's fine. If they cannot, I will ask the patient to turn his head to the side, away from the central line. I am careful only to touch the outer 1-inch border. Now I will place on my non-sterile gloves and remove the old dressing. I will pull down and away. I am holding onto the lines to keep them secure, and I am careful not to touch the insertion site. I don't want to contaminate it. I want to assess my site for any signs of infection, redness, swelling, drainage, inflammation, warmth, or crepitus in the surrounding area. I will remove and place my sterile gloves on. Taking my chloroprep, I will open it. I'm going to pinch the wings. If there are pieces of dried blood around my insertion site, I would take my chloroprep and wipe away using a different part of the chloroprep with each wipe. Then, using a second chloroprep, I would begin my cleaning or scrub. Scrub vigorously for 30 seconds in a back and forth motion. I will discard the chloroprep sponge, allow the area to dry. I don't want to blow on the site or fan it to make it dry, just allow it to air dry. Now I will apply my Tegaderm dressing. Note at the top there's a label that I will write time, date, and initials when I'm finished. I'm going to be careful not to tear this when I apply the Tegaderm. I will start at the top and peel it apart. I will place over the catheter, careful to smooth any wrinkles. And then I will peel the rest of the dress wrapper away. Making sure to tap down the edges to secure it. Now I will place the label on the dressing. I'm going to place it over the edge so it's not covering the insertion site. Now I will remove my sterile gloves, cover my patient, remove his mask. Remove my mask, place my side rail back up, lower the bed to the lowest position. dispose of my supplies and wash my hands.
So she did an extremely well job, very thorough. And I encourage you to watch the video several times prior to coming to the skills lab. The more you practice, the quicker that is going to go for you that day, and you will be able to work together in teams prior to checking off on your skill. After you've completed the dressing change, you want to demonstrate the appropriate documentation of assessment data and patient findings for a patient with a central line catheter. You'll want to make sure you document the time the procedure was performed, any patient education, for example, going over with the patient how to care for the site and making sure that it's not contaminated. Condition of the dressing and the dressing site. On the video, you see that she does a good job of assessing it to see if there's any signs or symptoms of infection. Document any indications of infection. Note line in use and what it is. For example, if this patient is currently receiving lipids, IV fluids, you're going to want to document that. Generally, prior to doing a dressing change, I will flush the lines just to make sure they're both working too. You also want to document the site care performed, what you used to perform that care, and adherence to sterile technique. Some line maintenance recommendations is that the line does need to be assessed each day for necessity. Patients do not need to keep a line that is not going to be used. IV tubing should be changed every 72 hours. Lipid and blood tubing is actually changed every 24 hours. And you want to scrub the hub before assessing lines with chlorhexidine or 70% alcohol. Now, the amount of time you scrub it for is going to depend on the facility. Some facilities require a lengthier time than others. You'll want to know your agency protocols. Avoid blood pressure and monitoring in the arm where the patient has the line. So I encourage you to watch the video several times prior to attending the skills lab. And if you have any questions, of course, I'm always available. And I look forward to seeing you at the skills lab for checkoff.